What is a disc bulge or herniation? Today we're going to go over what they are and what to do to make it better. Here is our spine, and top to bottom we have 33 vertebra or spinal bones, and in between each of these bones is an intervertebral disc or a little shock absorber, which takes a lot of compressive force when you're living your day-to-day life. And what can happen with either a major sort of trauma or repetitive microtraumas or just some degeneration, some wear and tear throughout your spine, you can place excess pressure on these discs. And the way the discs are formed is they have quite a fibrous outside called the annulus fibrosus and the inside called the nucleus pulposus, which is a jelly-like substance. And what can happen when you're causing excess pressure on these discs is you can get a little bulge out of the jelly-like substance, and if you cause a crack in that outside fibrous layer, it ends up getting called a herniated disc. And what can happen, this can cause some inflammation, it can cause some pressure on the spinal nerves as they're exiting, and that's why with disc herniations you can not only get back pain, but you can get pain coming down the legs as well. So what do you do if you have a slipped or herniated disc? In a second we're going to go over 2 exercises which can help you when you're quite acute in your pain, but I think it's really important to remember that with acute low back pain, bed rest is not recommended. We want you to stay relatively mobile, so stay walking, keep moving within your pain limits. And we also want to avoid trunk flexion, so really bending forward, avoiding that heavy lifting, really giving a chance for that extra part of that disc to recover. This next exercise reduces pressure on that disc bulge, and it's going to try and encourage the reabsorption of that disc bulge back into the disc. I would generally recommend for the next exercise to be performed on the ground, but today we're going to be doing it on the table just so you can see me on the camera. And we're going to start by lying on our stomachs. And what I want you to do from here is use your arms to push up and cause extension through the back of your spine. And really gently and rhythmically, I want you to come up and down. And you can hold that top position, and I want you to do this for 1 to 2 minutes, and it shouldn't be causing you any pain. It should be quite a relieving feeling. We talked before about staying mobile because you don't want to lose any range of motion in that low back. So this next exercise is going to focus on keeping some rotation in through your low back. We're going to again be on the ground, and we're going to have our knees bent for this one. And just gently, just as far as you're comfortable, you're going to drop your knees over towards the side, and it doesn't have to be far when you're feeling really, really acute. And as you slowly improve, you can drop your legs over further and further. Your shoulders and torso should always be flat on the ground here. Nice and controlled movements. And again, you can perform this for 1 to 2 minutes within your pain limits. If with your disc injury you're really prone to getting symptoms down into one of the legs, you may consider, as your back pain is not so acute, doing a neural glide exercise. And that's when either end of the nerve you're moving, so you're not placing any tension, but you're just moving that nerve through its pathway through the leg. To do the neural glide in the leg, we're going to bring our leg up on stretch. So it's important when you're stretching out one end of the nerve, you're releasing it off the other. So what's going to happen, we're going to place the leg up nice and straight, and as we bring the foot up, we're going to leave our head in neutral, and then when we point the foot, we're going to drop our head forward. And you should be getting a nice stretch through the whole back of the leg there. From side on, pointing head down, coming up. And we're sliding that nerve through its pathway. And this can be quite an aggravating exercise, so I want to make sure that you're not really acute when you're performing this, and you're only performing about 10 to 15 in a day. So guys, that was some quick advice and some exercises that you can do if you have a slipped or herniated disc. For more information, check out the link in the box below.